there's something called as MELD score, right?
Correct.
And it also affects the place waiting in the waiting list. So help us understand this a little bit more on this front.
Yeah, there are some important indications. There are important levels which we have to
Parameters.
see. So all over world, the MELD score is followed to understand that this patient requires transplant or not. This MELD score will give you the idea that at the end of 3 months, what is the mortality.
So what are the red flags which you consider in MELD score?
Liver cirrhosis with ascites like water, but that water is got infected at least one time also, then they should tell their family relatives that boss, we have to think about the transplant aggressively.
The liver doesn't ask for much, yet it quietly works every day to keep us alive. It filters toxin, processes nutrients, and keeps our system running smoothly. But when the liver begins to fail, the body starts to lose its balance, and life can change in an instant. For thousands, a liver transplant isn't just a medical procedure, it's the last hope. It's the moment when science meets survival, when waiting becomes praying, and when one's life loss can give another second chance to someone else. Today's episode doesn't just explore the life saving miracles of liver transplant, but it also shines a powerful light on the profound gift of organ donation, where one person's loss becomes another's second chance at life. This is the story of liver transplant, what they are, when they are needed, and how they offer not just more time, but the chance to truly live again. Joining us today is Dr. Dinesh Zirpe, Director of Liver Transplantation and HPB Surgery at Sahyadri Hospitals. Dr. Zirpe is a renowned liver transplant, pancreas, and hepatopancreatobiliary surgeon with over 500 plus liver transplants and over 1,000 laparoscopic surgeries to his credit. Dr. Zirpe is known for his expertise in living donor liver transplant, pancreatic cancer surgery, and advanced laparoscopic procedures. A recipient of the Young Scholar Award in GI surgery, he combines surgical precision with a deeply patient centric approach. An All India topper with gold medal in his kitty, his work addresses complex liver, pancreatic, and biliary conditions using cutting edge techniques, and he leads a multidisciplinary team that is committed to world class care. Hello and welcome to Sahyadri Health Talks. I'm Dr. Tushita, and today we have with us Dr. Dinesh Zirpe.
Hello.
Hello, sir. How are you?
Hello, madam. How are you?
I'm good. Welcome on Sahyadri Health Talks.
Thanks a lot. Thank you.
And it's wonderful to have you on this platform. So, liver transplants,
Yes.
incredibly challenging, incredibly rewarding, and also, working with patients during their critical moments where such high stakes are involved. How do you keep yourself so calm among all this? How do you keep yourself grounded?
No, so I think to give the best of you, you have to be calm. If you are not in your own senses, then obviously you cannot give the best skills, best decision. So the first thing, that's what the transplant is mainly driven by the passion.
Mhm.
If you do not have that passion, no, then you cannot drive the transplant program also. So there may be a chance that multiple things are involved, multiple lives are involved, but what you think is that one, what is the best for the patient, and what science tells you the best for the patient, and that has to be combined, and then you can give the best outcome. So I think keeping calm is the best thing for a transplant surgeon also. So whenever we are doing transplant surgery also, maybe I can call you sometime for our transplant
Please do.
surgery to see how
Yes.
the way we do it can't be the shouting thing. What people used to think the surgery is very much tense thing.
Mhm.
If your assistant is also tense, no, then still it will decrease your outcome,
Mhm.
your success.
Mhm.
So I feel everybody should be in a good mood, good shape to do the work what they are intended to do.
So, Dr. Dinesh Zirpe, the face of liver transplant, Was this a pre-planned thought of yours, or was it destiny which made you do this?
So I think one thing I was pretty sure when I joined my MBBS, the first year only, I was pretty sure that I want to be the surgeon.
Mm.
Then so there was no doubt. So when
Mhm.
I went for my counseling also, I had options of other specialties also.
So, what
But
motivated you to take liver transplants?
I love surgery, undoubtedly. So that day, when we were doing the first year of MS, that time also, I was pretty sure that I want to be in a GI surgery or a transplant surgery. So in MBBS first year, we have that anatomy
Mhm.
hall. So we used to go in the anatomy hall to see what is the described thing. Then there's one book, Cunningham,
Mhm.
which tells you how to dissect.
Yes,
I was in love with that book.
the great Cunningham.
Yeah, and it just looks, the name is just like Sherlock Holmes.
Yes, well, I mean, a lot of inquisitiveness comes along with it.
Correct.
So, Dr. Zirpe, during his first liver transplant surgery, and
Mm.
Dr. Zirpe, on after completing 500 plus liver transplant surgeries, how has Dr. Zirpe evolved, and how has this journey been?
Yeah, so basically every patient teaches you. It is whether it is, we know that there is a routine track, routine things which is expected, but every patient has something different.
Mm-hmm.
So unless and until we are open for that, we cannot learn. And that learning comes only when we are open for the new things,
Mm-hmm.
open for the new ideas. So every patient is like, over 500 transplant, every patient has taught us something different, something new, which has developed us, which had made us better as a surgeon,
Mm-hmm.
as a decision maker also. So I definitely think, so when we do our first transplant, so that is not the thing that you are directly going to do a transplant, first transplant. It is experience of previous 300, 400 transplant which you have assisted, which you have
Yeah.
exposed, you have managed, and then you finally decide that okay, now you are taking the calls and now you are doing the surgery.
Mm-hmm.
And I still
You
have a
have that
good
memory?
contact with that patient currently
Acha,
also,
okay.
and she's doing wonderful.
She is doing
Yeah.
wonderful. So, do you still have the memory of that first transplant fresh in your heart?
Yes, 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 100%.
And
So
it still gives you the thrill when you, reach out and do another liver transplant.
correct, correct. So basically, in transplant, it happens like it is primarily the responsibility. It is never the first transplant. Like
Hmm.
when you do the surgery, that you can have the first surgery.
Hmm.
But when you're doing, it's like when you're reached till the transplant, it is very niche skill set, niche
Mhm.
area.
Mhm.
So it is not your first surgery. You
Mhm.
have done lots of major complex surgeries, and then you get that thing. So
Mhm.
that first transplant is primarily the responsibility. It is obviously surgically you are doing same things, but the responsibility is something different, which you get that now. Anything what is going to happen in the future also, it is
Your
your name, your
responsibility.
responsibility.
Yeah.
So that way it is more important. And definitely we every surgeon has that memory, I think.
So that burden of responsibility, ownership, does it lead to burnouts anytime in you?
No, I think yes. Sometimes there can be a situation that it is too tense, but then obviously the teamwork comes into the picture. If you have only single person working, only doing the same thing, and just taking the calls, then I think that is not a correct way to go ahead. Means you may be able to do a limited number of cases, but if you want to achieve the goal, you have a good vision, then it has to be with the teamwork. So when
Mhm.
you have good team, then obviously everything supports, then they are there with you, then they will tell you I think this. And the a good leader should always ask other
Mhm.
team members also, what do you think, and
Mhm.
then what we should do. So it
Mhm.
is never like okay, there's only one person is doing
It's
all
not
the
a
work.
one-man army job.
Correct. Yeah. That, and that everyone knows, but
Mhm.
everyone should have that satisfaction that we are involved. That
Mhm.
way, I don't think then burnout happens. It's same thing. Is if you want to travel from Pune to Delhi or Kanyakumari, if you can obviously drive
Mhm.
single-handedly.
Mhm.
But that, I don't think the charm is like you go like dil chahta hai. You have 2 3 people with you. You
Yeah.
share the travel. You share everything.
Stories and all
Yeah.
that. So it's more or less kind of a team approach, which brings out a
Correct.
lot of difference. And this team approach also brings a lot of approach towards the treatment plan for the
Correct.
patient, right? So now coming to the liver transplant part of it, as the name itself suggests that it's a transplant which requires another a liver to be
Correct.
replaced. So, what are the situations in which a liver transplant is required? Because of late, because of the lifestyle and kind of lifestyle and the food habits that we have, fatty liver, cirrhosis of liver, these are something which are becoming more common,
Correct.
day to day life. So, when is it that such worsening of liver condition lands up into a requirement for a transplant? Is my first question to you. And the second one is, the moment the word transplant comes, most of us, what we think is it's a transplant or a availability of an organ from a cadaver, which is somebody who has passed away. His organs are donated, but which is not true in case of liver, because liver also has live donation which happens. So help us understand about these two aspects of it.
Correct. So first question is like, who needs the transplant?
Yeah.
The patient who is having a liver issue are all required to undergo transplant? So definitely no. See, God has given us good extra volume of liver. So around 70% of the liver is extra for us. So that's why somebody actually can donate 70% from his liver to the other person. And liver is the only only organ in the body which regrows.
Yeah.
So around, if I donated around 70%, the rest of the liver is going to regrow, and which will regrow over around 12 weeks to near about the previous level.
So
that
in
is the
12
beauty.
weeks, it grows back closer to 70%,
Correct.
which was donated.
Yes. So actually, we do not keep on measuring that how much it is grown, because it is not required.
But this is a rough
But
number.
yeah, so it is irrespective of the patient decides that, oh no, I don't want my liver to grow. Still, it won't happen. It will grow at its own pace. So that's the beauty of the liver. Now coming to the question of who needs the liver transplant. See, the God has given us actually extra 70% of the liver.
Achha.
So when the liver is damaged more than 70%, then only most of the times you get the problems, symptoms regarding the liver issues. So जैसे कि you say बबन ने 50% मार्क्स लाए तभी वो पास होगा. तो अगर बबन पास हो गया उसका मतलब 50% से ज्यादा मार्क उसको मिल गए. सेम थिंग, अगर आपको लिवर का प्रॉब्लम दिख रहा है या सिम्टम्स आ रहे हैं, उसका मतलब कितना परसेंट से ज्यादा डैमेज हो गया, हाउ मच ऑलरेडी इट इज डैमेज, इट इज अराउंड 70%. सो दैट इज द डिफरेंस. Whatever I'm saying, that the once your liver is damaged beyond 70%, then you are only going to get the symptoms. The corollary is, once you're getting the symptoms, it's already more than 70% damage.
So damage is already
correct
caused.
So that's why those who have fatty liver grade 1 grade 2, they do not have any issue. They feel okay, I'm good, I don't have any issue, any problem. Why people are so much bothered? But we shouldn't wait to reach till that point that the body itself is telling, no, now my liver is not able to function well, you do something. So that is the first important thing. Now once you have got that, now you are getting some issue, some problem, are we going to do transplant? No. So every patient has two factors. One is modifiable, one is non-modifiable. Means modifiable means if the patient is having diabetes, obesity, his weight is around 100 kg and that is troubling his liver, definitely we can manage that thing. So if that goes down, maybe liver recovers. If somebody is drinking alcohol and he is stopping that thing, maybe over 5 to 6 months he may get better. So that doesn't mean that that there are some things which are modifiable. Those modifiable factor we have to manage. If patient is having hepatitis B, we can manage that. Hepatitis C, we can do antiviral treatment. However, there are some non-modifiable factors such as age. Now your age,
you cannot reverse it.
Correct. Course. You cannot give medicine. You can't do anything. If you have genetic problem, then you can't do anything. In those cases, I think definitely we have to be little bit on the upfront force to go ahead with the transplant. But those who are manageable, so every first symptom is not like indication for transplant. Achha. Then we try to manage with medicines. हम थोड़ा दवा देते हैं, थोड़ी दुआ देते हैं, and then definitely अगर उससे भी नहीं होता है तो obviously we are there to solve the problem. So now the patient is not recovering with the medicine, with the antivirals, and still getting problems. So what are those problems? So one patient having water in his tummy, that is called ascites. That is going so high that you are requiring to tap it, means you have to remove that water repeatedly. Surgically. So those are not good indications. Then your other issues like ammonia level going up, that's why patient is behaving erratically, or patient are repeatedly going into coma. Then there are some issues like patient's jaundice is not getting better. It is around 5, 6, 8, 14. Sometimes it goes up to 43, 73. So that high patient bilirubin can go up. So those are other problems. Sometimes other organs are also start getting effect. Like kidney. So kidney creatinine goes up. Sometimes brain gets edema. That's why they go into coma. Sometimes blood pressure starts going down. So those are not good signs.
Symptoms or signs.
Overall, that is the time when we should think that patient should be evaluated by a transplant team.
And that's when a post evaluation, then we search for a donor, and the
Correct.
donor part is done. So there's something called as MELD score, right?
Correct.
And it also affects the place waiting in the waiting list. So help us understand this a little bit more on this part.
Yeah. So basically, most important thing what a patient should know, that if we tell a patient that okay, he needs a transplant, we do understand that what that impact is going to happen with him, with his family, overall, or what they are going to think. So nobody, if I'm a transplant surgeon, that doesn't mean I'll go on doing transplant anyways. It is only if it is indicated, then only we are going to tell. That is first thing. So when we see that patient is having liver problem, it is not like by seeing only we will say no, now you go ahead with the transplant. There are some important indications, there are important levels which we have to see. So one of them, obviously, one patient should have problem. Okay, that means clinically he should have jaundice, he should have some issues. Second, biochemical levels, like his platelet count we will see, his albumin level will see, INR level will see. So there needs to be some derangement in that. Then imaging, that means we take a photograph, which may be using sonography, CT scan, or MRI. So by seeing that, we check what is the condition of the liver. It is nodular, it is small, shrunken. So if it is a shrunken liver, very less possibility that it might regrow to a normal liver.
Achha.
So that patient has to understand. So with that also, we don't stop. So all over world, the MELD score is followed to understand that this patient requires transplant or not.
Achha.
So what is the importance now that, as that will come to in
later part
that there are two types of transplant which you just asked. One is brain dead and then living donor. So in a brain dead patient, if we have a liver available, whom we should give the priority. Now the sicker patient should get the priority. So how do we decide which patient is sick?
Based on this.
So MELD score comes into the picture in that. So MELD score is actually used, calculated using creatinine, bilirubin, INR, and sodium levels. So if it is deranged, then the MELD score will be low. If it is 16 or more, then patient is a candidate for liver transplant, which is followed all over world. Now if a patient is having 30 MELD score and a patient is having 20 MELD score, who's sicker? The one who's having 30. The
higher the MELD score, the more serious
is the condition. So it cannot be highest more than 40. So highest is 40. So 40 is like patient is very sick. You have to transplant as early as possible. So patient should understand that more he becomes sicker, the chances of success little bit goes down. So that's why earlier they do, overall success rate is very good. So MELD score, most important thing is it gives you 3-month mortality. Matlab, when you discuss any patient like cancer patient, okay, normally as a relative, what we ask to a doctor, now we come to know that somebody in the family is having cancer. What we ask, सर कितना दिन बचा है, कितना महीना रहेगा, अगर कुछ नहीं कर पाए तो. So normally what answer we expect is like 6 महीना, मतलब बहुत सीवियर है तो 6 महीना, 5 महीना, sometimes they say 1 year, 2 year, correct? But this MELD score will give you the idea that at the end of 3 months, what is the mortality. That means I'll give you I have a patient whose MELD score is around 30. Okay, so we calculated the patient score, it is 30. So the mortality, 3-month mortality is 52%. That means that patient, the one who is having MELD score, if I have 2 patients, one of them may die within 3 months. That is the severity of the MELD score, and that is the severity of liver disease. But people fail to understand that it is more dangerous than the cancer. You understood? That's why,
because it worsens.
It goes down along with other organs also. It will take down your kidney, it will take down your heart. So there is no, at that point you cannot change only liver, because other organs.
So the chances of multi-organ failure goes up very high.
Correct. So higher the MELD score, chances of multi-organ failure is high.
Is very high. So what are the red flags which you consider in MELD score?
Correct.
You know, what are the absolute red
flags? Very important question.
Yeah.
Why? Because most important thing which we observe in a patient is like denial. They feel I do not have much problem. It's just some water in the tummy, but that's okay. I'm able to manage. But they should know that how we decide, how we say ki no, you are not doing well. So one thing is that having water in your tummy is one of the symptom of liver failure, correct?
Hmm.
But infection in that water is
Hmm.
not at all good sign. That is called
Acha.
SBP,
Acha.
spontaneous bacterial peritonitis.
Acha.
That means that water is getting infected.
Mhm.
That means your overall immunity is going down. So that's why infection fighting power is gone down.
Acha.
So that's why the patient should earlier undergo transplant. So if anybody in the family is having liver cirrhosis with ascites like water, but that water is got infected at least one time also, then they should tell their family relatives that, boss, we have to think about the transplant aggressively. So then they can go and talk to the transplant surgeon and take a call.
Mhm.
So second thing is sodium level.
Mhm.
So if the sodium is low, if I have two patients,
Mhm.
so one patient is having sodium level around 130,
Hmm.
another patient is having sodium level around 120.
Mhm.
The one who's having 120 is sicker, and he
Acha.
should undergo transplant earlier. So that's why they should understand. So most of the time they feel वो तो ऊपर नीचे होता रहता है, उसमें क्या है इतना, but it has important prognostication.
Okay. Why is liver transplant in particular so complex when compared to the other transplants?
Yeah.
What makes it so complex? Is it? I mean, see, on one hand, we do understand that liver plays a multi-purpose role or something like that. It's like
More than 500 functions.
Yeah, I know, right? And उसको जो मतलब हमारे कहावत में जो है ना जिगर का टुकड़ा. So there is a reason why we call jigar ka tukra, because jigar is so important, right?
Correct.
So, but what makes it so complex? Maybe probably more complex than a heart transplant. Why is it so complex?
Yeah, so basically there are some organs which are like end organs. Without that we cannot survive. So comparing, it is difficult comparing heart, lung, liver with each other, because every organ is required for the survival.
Yeah.
So as compared to kidney transplant, we have some machine for the kidney, like you have dialysis. So if the kidney stop functioning, still we have machine to offer for the patient. So we can put that patient on dialysis thrice a week, 4 times a week, and then patient can think, oh, my kidneys are gone, let us think about transplant. But when liver goes down,
there's no such.
Correct. We do not have any machine that, okay, I'll put the patient on the machine. Then the relative, the patient can think.
Take time.
Correct. So the point liver goes down, it takes other organ also down. So that's why then kidney goes down, then BP goes down, heart goes down, and then then the relative decide, कि नहीं अभी करना है. That time the patient itself is not in a good condition to go ahead with the transplant. So same thing. Now, if at all kidney transplant happens, okay, and we do the kidney, and kidney does not function well, what we will do? Patient may again go back on the dialysis. He goes. But now if we do the liver transplant and liver does not function well, what option we have?
Actually, I have a question on that as well. What happens post liver transplant if the body rejects the transplant?
Correct. So basically, over the time, the science has advanced very well. That's why overall rejection rate has gone down. Very much it has gone down. So, but still there are some things like primary non-function, which is like less than 1% cases, the liver may not function well. But that's why it makes it so much complex that it has to do well. We have to do utmost care that it should do well. So that is the most important answer what you wanted about your question. And then second thing is rejection. So the liver, that is for all transplant, means whether it is kidney, liver, heart, the organ is not his own body's organ. That's why the body tries to reject that organ. So to prevent that thing, we have to give some tablets, some medicines. Those are called immunosuppressants. So once we give that, our immunity goes little bit down, but it is not very much down. So as compared to general population, it will be little bit less. And that's why we have to ask them to take some precaution in initial 2 to 3 months.
So that the body gets used to the
that
new
liver,
graft, and then eventually the body can act normal.
So over the time, the overall dosing of that medicines goes down, but it is not zero. So a patient may require to take some medicine, which may be a lower dose, but lifelong they have to take that medicine.
Okay. So one part of it is the the process itself being so complex. The other part of it is finding the suitable donor. So as we spoke already, right, there are two types of donation which happens. One is a living donor, the other one is a brain dead patient. So what are the criteria to find a suitable donor, and how does it work?
So whenever we offer the patient, that patient needs to undergo liver transplant, he has two options. One is he can register for a cadaveric brain dead list.
Hmm.
That means it is a list which is managed by the government. So it is according to the blood group. So if patient is having B positive, so positive negative, it is not that much matters in liver transplant. So the patient is registered under the B waiting list.
Achha.
So now the waiting, according to the waiting list number, he is being called for the. So whenever we get the donor available, then our coordinator calls them that we have B blood group donor available for the liver. So if you are willing, you can come for the transplant. So that is the routine protocol. So what is the limitation in this? We do not have very high number of organ donation. So there is very much high demand, but there is not much supply for the organs. So same thing means organ donation is not in very high numbers. So that's why many of our patients keep on waiting only. So they do not have other option. But then some patient cannot wait so long. As I told you, like MELD score of 30, he may not survive more than 3 months.
More than 3 months. Yeah.
So how he can keep on waiting?
So what do we do in such
Correct.
situations?
So then the question of living donor liver transplant comes in the picture. So say anybody in the family, the patient, donor has to be relative of the patient.
The first bloodline.
So the patient, we need to prove that he is a relative.
Achha.
It is not necessarily only first line, but
Achha.
obviously it is always preferred to have a first line donor.
Achha.
So that donor should be 18 to 55 years of age. It is not a fixed criteria, but average, I'm telling you that generally this is the guideline. Around 18 to 55 years of age, the donor should not have any major comorbidities. Donor should not have any major surgery or any addiction and any other major problem like psychological illness also. If things are okay, then we evaluate that donor in 4 stages. If all 4 stages are clear, like first stage is a simple test in which we will test sugars. If the sugar itself is 350, then there is no use in doing further evaluation. Same thing, so we'll check hepatitis B, hepatitis C, we'll check blood group again. So stage 1 is a very small stage in which we just do the routine basic test. If in that only the
basic
donor is out. Correct. So if the donor is out in those tests, we do not go ahead with the second stage.
Achha.
Second stage is like CT scan, MRI, in which we check how much is the volume of that donor liver. Then if he is going to give you right lobe, the left lobe is sufficient for the donor or not
to survive.
Correct. Then after MRI, CT scan, then we do advanced testing in which we do simple testing also, like cholesterol, thyroid, and then advanced testing, everything. So if all those important tests are also negative, then our specialists see that donor, like cardiologist, pulmonologist, hepatologist, and if they also say that this donor is good to go,
fit to
correct, we
donate.
Can give the clearance for the surgery. Then the government committee happens,
Achha.
which takes the interview in front of video with the patient and with the donor. That what is the problem, why are you donating, what is your relation, and once they sign, after that we can go ahead with the transplant.
So considering a patient with MELD score of 30, which is like approximately 3 months of survival chances, how fast and what is the duration of this entire process? How long does this take?
So sometimes there is a condition called acute liver failure, where the patient was doing good yesterday and suddenly now his liver is not functioning. So in that case, though, we don't have this much time also. It is like 3 days only you have to go ahead with the transplant. So, and we have done that transplant within 32 hours also. So we had one patient who came with on ventilator with us. So once the liver doesn't function, the brain edema goes up, and then after some time brain cannot function.
Achha.
So that's why that is the time period we have to do as fast as possible. So around 48 to 72 hours. So we have done one transplant when the patient came to us within 32 hours. That boy's mother donated to his to him, and we completed the transplant within 32 hours.
So
and the boy is doing fine.
So basically, it can be expedited.
Correct. It all depends on the critical condition of the patient and overall the requirement. Means if the patient is matching the criteria for ALF, it has to be very urgent. If it is not ALF, then normally the documentation work is most important, like proving the relation. If the husband wife is there, then maybe marriage certificate is required. Most of them, they may not have the marriage certificate. Then they'll have
because
to search
they come from
for
very
that.
rural
Correct.
areas.
So that's why that. But you cannot skip those processes, or you'll have to have some something as an affidavit to tell that this is the real condition.
So this was about more kind of the when a person needs a liver transplant, what are the things that are to be taken in consideration. So we have spoken about what are the types of liver transplant, what is MELD score, and what are the prerequisites of being a donor, and how can the liver can be donated, what are the criteria of it. We will continue this conversation in the next episode, which will be continued, and we will be going in depth about knowing everything about what happens in a liver transplant, what happens inside that OT room, and what magic does Dr. Dinesh Zirpe does there. So stay tuned with us in the next episode. Signing off, Dr. Tushita.